If you are approaching age 65, or if you are already retired, I want you to stop what you are doing right now and listen to me very carefully. We need to talk about the single greatest threat to your financial freedom, your peace of mind, and the retirement nest egg you have spent 40 years building. I am talking about the confusing, overwhelming, and often terrifying world of Medicare. So many of you think that the moment you turn 65, the government just steps in and hands you a magical card that makes all your health care free. You think, Susie, I worked hard, I paid my taxes, I'm safe. No, you are not. That is a massive illusion, and if you buy into it, it will break your financial back. Healthcare in retirement is not free. In fact, if you make a single wrong move, if you miss a single deadline, you can face massive lifelong penalties that will drain your monthly Social Security check before it even hits your bank account. I don't want that for you. I want you to be in control of your money, which means you must stand in your truth and understand exactly what Medicare is and what it is going to cost you. Let's break it down to the absolute bare bones, because you need to understand the pieces of this puzzle to protect yourself. Medicare is divided into different parts, and they all do different things. First, you have Original Medicare, which consists of Part A and Part B. Think of Part A as your insurance for when you are lying down in a hospital bed. It covers inpatient hospital stays and skilled nursing facilities. Now, for most of you, Part A is premium-free. Why? Because you or your spouse paid Medicare taxes for at least 10 years while working. But free premium does not mean free care. If you get admitted to the hospital, you are hit with a deductible right out of the gate, and it is a heavy one. You are looking at over $1,700 just to walk through the door for a benefit period. Then comes Part B. Think of Part B as your insurance for when you are standing up, your doctor visits, outpatient care, lab tests, and medical equipment. Part B is absolutely not free. Everyone pays a monthly premium for Part B, and that premium gets deducted directly from your Social Security check. The standard monthly premium is over $200 a month per person. If you are married, double that. That is thousands of dollars a year out of your pocket just to have the insurance. And before Part B pays a single dime, you have to meet an annual deductible, after which Medicare only covers 80% of your doctor bills. Who pays the other 20%? You do. And under Original Medicare, there is no limit, no ceiling, no maximum out-of-pocket cap on that 20%. A major medical crisis could completely wipe out your savings if you are not careful. Now, because Original Medicare has that massive 20% gap and doesn't cover regular prescription drugs, you have to make a choice on how to protect yourself, and this is where so many retirees get completely paralyzed by fear. You have two paths you can walk down, and you must choose wisely. Path number 1 is staying with Original Medicare and buying 2 extra pieces to shield your wealth. You buy Part D, which is your private prescription drug plan, so you aren't paying full price at the pharmacy counter. You also buy what is called a Medigap or Medicare supplement policy from a private insurer. A Medigap policy is your financial shield. It steps in and pays that 20% coinsurance that Original Medicare leaves behind. It gives you absolute predictability. You pay a monthly premium, and in return, you can go to any doctor or hospital in the United States that accepts Medicare, with no networks and no gatekeepers. Path number 2 is what is known as Part C, or Medicare Advantage. Private insurance companies advertise these plans aggressively on television, shouting about $0 premiums, free dental, free vision, and rides to the grocery store. It sounds incredible, doesn't it? It preys on the fear of retirees who are trying to live on a fixed income. But you must look under the hood. Medicare Advantage plans operate like an HMO or a PPO. You are confined to a strict network of doctors. If you want to see a specialist, you often have to get permission from a primary care doctor first. And while the monthly premium might be $0, you pay copays and coinsurance every single time you see a doctor or get a test, up to a maximum out-of-pocket limit that can run into thousands of dollars a year. If you get seriously ill and need to see the best specialists out of your area, a Medicare Advantage plan can restrict your access or cost you far more than you ever anticipated. The fear of making the wrong choice causes so many people to procrastinate, but procrastination is the thief of financial security. If you miss your initial enrollment period, which is the 7-month window around your 65th birthday, the consequences are brutal. If you do not have employer-sponsored health insurance from a company where you or your spouse are actively working, and you skip signing up for Part B, the government punishes you. They tack on a permanent 10% penalty to your Part B premium for every single 12-month period you were supposed to be enrolled but weren't. You will pay that penalty every single month for the rest of your life. The same goes for Part D prescription coverage. Miss the deadline without creditable coverage, and a permanent penalty is added to your drug plan premium. Here is your actionable takeaway, the steps you must take right now to secure your future. 3 months before you turn 65, you need to go to Medicare.gov and create your secure account. Look at your current financial situation, your health status, and your medications. If you value absolute freedom to choose your doctors and want predictable monthly costs, look seriously at Original Medicare paired with a Medigap policy and a Part D drug plan. If you are on a very tight monthly budget, healthy, and comfortable staying within a local network of doctors, look at Medicare Advantage, but read the fine print on what you will pay out of pocket if you face a major illness. Do not let the fear of this system paralyze you. Face the numbers, respect the deadlines, and make a conscious choice. True financial freedom is not about how much money you make, it is about having the security of knowing that a health crisis will never jeopardize the roof over your head or the food on your table. You have worked too hard to let healthcare costs take away your power. Stand tall, educate yourself, and protect your tomorrow, today.